Hi, I'm Dr. Jamison Spencer. Today I'm going to show you how to fit the silent sleep using a thermoplastic bead technique instead of the GC reline material or other VPS material. So here we have thermoplastic beads. The beads, as they would come to you, look exactly like this. And these can be heated up in various ways. You can either use hot water. So this is boiling water. I'll just pour that in there. I'll let that set for a while and you can see what that does. Or, which is the method I usually use, can be warmed up in the microwave. So this has been warmed up in the microwave in advance, and I'm going to fit the silent sleep tray with this. Now, using the thermoplastic beads is different than using the reline material. The reline material, we're going to fit the upper and lower simultaneously using our bite gauge. I like to fit the lower first and then the upper second when I'm using the thermoplastic beads, or any material that is potentially very retentive. So acrylic is going to be retentive, thermoplastic beads are going to be retentive, and so it's important that you do this in a stepwise manner so that you don't lock something in. Okay, so how we're going to do that, I'm going to get my fingers wet a little bit here and pinch up some of this material. And place it in the lower part of the tray. Hands wet again. It's advisable to always wear gloves when you're doing this, because if you have the thermoplastic too hot and it sticks to your gloves or starts to burn your hands, you can rip your gloves off. Okay, so that's a sufficient amount. The lower, it's protruding through the holes just a little bit. This is going to bond very well to the silent sleep tray, so it's not critical that it go through the holes all the way. Okay, we're going to take that to the patient's mouth. Open. And I'm going to fit that and pay attention to not letting the lower bar hit the lower teeth. I want it close as possible, but I don't want it to actually touch the teeth. And close down for me. And you can actually close and bite down pretty good. Open. Close. Okay. And just kind of close around that. I'm going to let that set up for a second. If we'd like to speed this along a little bit, I can actually have her take a sip of cold water. Take a sip of that and try to slosh that around. Swallow. Do that a few times for me. Okay. And open. We'll start to see this get a little more opaque. Still pretty clear, so I'll give that a little bit more time. Now, Jenny doesn't have any risk of us locking this in, doesn't have any bridges or anything like that. But here that is now been pushed down on the teeth. This is a little bit excessive. I don't need that much material, so I'm going to go ahead and trim that off with scissors. So I'm going to cut just a second while I trim this with scissors. I'll go ahead and cut. So I'm going to go ahead and trim off the excess with scissors. These long-handled crown and bridge scissors tend to work the best. This will trim up very easily. I can almost make that flush with the tray itself. With the reline material, I would usually leave excess, but with these harder materials, it's not as important to have excess material. Now this is going to be kind of rough, so how we smooth that out is just by dipping it in the hot water pot, and then that will turn a little soft right at the edges. You can just smooth that with the finger, and that's as smooth as you would need it to be. Doing this with a handpiece is not advised because it will gum up your burr. So just smoothing this out with your finger works pretty well. So I'm going to warm that just a titch on both sides. And we're going to go back to the mouth again. And open for me. I should be able to slide that right onto her teeth. Okay, she can close down again. Good. And open. Okay, now I would like this to fit with a bit of a snap. We have pretty good retention there. If I take this and run it under cold water, then it's going to snap set. This is going to give us a little bit more retention. If we were wanting less retention, we could put it under the warm water and take it off and on the teeth several times until we got the proper amount of retention. With that set in the cold water now, I should be able to put that down again. And now that is pretty snug. Okay, so that's where we want that to be for the lower. Now we're going to bring the jaw into the proper position. We're going to use the silent sleep bite gauge for this, and she's going to close and go into the groove on the silent sleep bite gauge. So now that we have the lower in position, open, we just need to add our material to the upper, and then we'll have her close with this inner mouth with the silent sleep bite gauge in place. You could also use a George gauge or other method, but we close down with this in place to get the proper mandibular relationship.